So this is Heather Hall, and I'm here to talk to you today about critical thinking, a key piece of the puzzle. So Albert Einstein, a wise man, he once said, "The whole of science is nothing more than a refinement of everyday thinking." So how exactly does this apply to nursing? Well, with the vast amount of nursing theory and the growing volume of information nurses must retain, it's critical for nurses to develop a systematic thought process which will allow them to quickly analyze and process data, determine a plan of action, and evaluate the plan for effectiveness and the presence of bias. So after reviewing this presentation and the assignment to follow, I hope the student will appreciate the role of critical thinking in nursing, be able to discuss the importance of critical thinking, identify the 4 phases of critical thinking, relate critical thinking to the nursing process, recognize positive traits of a critical thinker, and explain how critical thinking impacts nursing care, and list critical thinking development strategies. So the concepts represented in the diagram play a key role in the critical thinking process. The nurse must identify and tolerate the ideas, arguments, statements, and beliefs of others, as well as consider his or her own feelings in order to understand inferences and eliminate assumptions. So critical thinking, it's a highly desirable skill acquired through practice and experience. In order to develop critical thinking skills, the nurse must be fair-minded and possess the ability to continually evaluate, reflect, and refine the quality of thinking. The critical thinking process has 4 teaching phases. The concept formation phase is where you utilize your own knowledge base to determine common characteristics and prioritize actions. And then the data interpretation phase is where you will do differentiated information, associate shared characteristics, and assign meanings to daily observations. And then you'll apply the principles. So you'll explore the nature of the problem, and then you'll connect the dots. You'll connect the clinical concepts and predict possible outcomes. And then as the process is going on and after the process, you'll interpret your feelings, or even the patient's feelings can be included in that. So the critical thinking process and the nursing process have some similarities. The critical thinking is a valuable tool needed to carry out the nursing process, and both processes provide structured steps to utilize and make an informed judgment, but neither of them stand alone. So to effectively utilize the nursing process, the nurse must be an effective critical thinker. So there are some similarities with concept formation and assessment. You're going to identify data and determine common characteristics and obviously prioritize. And the interpretation of data is somewhat similar to the diagnosis process. You're going to differentiate diagnoses and establish a cause and effect and determine the significance of what has been observed. And so with the diagnosis process of the nursing process, you formulate a nursing diagnosis. So you're doing those things as well. And then that's kind of changes with the application of principles. So you're going to analyze the nature of the problem and isolate relationships. And then finally, with the critical thinking process, you're going to interpret the feelings, attitudes, and values. So you're having a more holistic approach with the critical thinking process. And with the nursing process, you're also evaluating, but you're evaluating that your nursing diagnosis were achieved versus evaluating feelings, attitudes, and values. So some similarities, also some differences, but they both processes have to be in place to make a sound clinical judgment. So some critical thinking development strategies. We've listed some of these for you, and there's some debate about critical thinking and whether it's a skill that can be taught. The basics of critical thinking, which we've talked about today, can be taught, but it's up to the nurse to practice in order to become an effective critical thinker. So some ways to build on your critical thinking skills are through the use of case studies, through clinical rotations, role play, Simulation technology can be done in the lab. You share your experiences with your peers. Your peers are some of your best sources of information. Ask for input from your peers. So what am I doing wrong? What can I do better? Ask questions. Ask questions. Ask questions. And explore the unfamiliar. Don't be afraid to try something different, to learn from somebody new. So all of these things are great, great clinical strategies to developing critical thinking. So there are some positive attributes of a critical thinker, and some of these that can be identified are confidence and flexibility, being reflective. So being able to reflect on a process, or maybe debrief after a code or something like that. Just look at what you did right, what you did wrong, and the things that you can do better in the future. Perseverance is another one. Being creative. So being thinking outside the box. Also, having a relative perspective, being inquisitive, asking questions, having intellectual integrity, and being open-minded. So why is critical thinking important? Well, effective critical thinking skills are needed to make sound clinical judgments. And it affects not only the patient, but all members of the healthcare team. So the development of sound clinical judgment helps to improve patient safety and reduce medical errors, reduce preventable complications, and evaluate current nursing practice or care. And that leads to the development of a future evidence-based practice. So to apply what we've learned, I have just a very simple case study here that will take some of the information from and break it down into the phases. So today we have SD. He's a 50-year-old male, and he's just been admitted for nausea, vomiting, and diarrhea. He's recently had a trip to Mexico, and we have started an IV, and we entered the room and noticed that his emesis basin is full of vomitus, and he's had a large watery bowel movement. And he said he feels dizzy, he has poor skin turgor, he's hypotensive with a blood pressure of 90/60, and his mucous membranes are dry. So let's think about what information do we have, and what observations can be made from the case study. Can we connect anything with this information? And what are possible causes of his symptoms? And what's significant about his current status? What are outcomes that we should consider? And what actions should we take? So let's look at some of that. So for the concept formation phase, we want to look at the patient's information and observations that we've made. I mean, he's 50 years old. He's got signs and symptoms of nausea, vomiting, diarrhea. Subsequently, he feels dizzy, he has poor skin turgor, he's hypotensive, and he has dry mucous membranes, and he recently visited Mexico. So data interpretation. We're going to look at his signs and symptoms. He has signs and symptoms of dehydration, and most likely related to his nausea, vomiting, or diarrhea. And it could be a travel-related infection. It could also be related to comorbidity, so we need a little more information. We need some history, more history on the patient. So applications of principles, what are the things we're going to be concerned with? With nausea, vomiting, diarrhea, dehydration, we might have electrolyte imbalance. Dehydration, what are the possible causes? And what are the patient's current needs? So interpretation of feelings, we want to be flexible. We don't want to pass judgment on the patient. Dysentery from being in a foreign country sometimes can be from sanitation issues, not necessarily the patient's sanitation issues, maybe sanitation issues from the water, things like that. So, be kind, be flexible. It's not always a great situation to walk into a patient's room that has all of these situations going on. Just be kind and cognizant of your reaction to the patient. And so this process that we would go through to make a clinical judgment to decide these are the things that we see. What now are we going to do for this patient? So that's, simply put, the critical thinking process. So do we have any questions? And if not, this will conclude our presentation and we'll have a quiz to follow.